Okay, today we're going to talk about lifestyle management, which is chapter 18 in your primary care book. So hopefully you read that before you listened to the lecture. This is a very important part of clinical practice, along with all the other preventative things that you are doing. Lifestyle management is really important. So, your life is affected by a lot of different things: your career, your health, your community, your faith, by your financial situation, your friends, what you do for fun. So there's also an interconnection between several things. And one is obesity is interrelated to, uh-oh, what did I do? Sorry. Must have touched something. Okay, so we're going to go back. So obesity lots of times can be interconnected to a sedentary lifestyle, whether it's kids playing video games or adults that have a sedentary job or elderly people that are not getting up and moving around a lot, stress, also your diet and what you're eating. So as most of you know, obesity is a huge problem in the United States. I don't really see it very much when I go to Africa, if any. Even Nicaragua, maybe just a couple people, but most people in other countries are very thin. We have actually too much food. Is our problem is people are just eating too much food. So this is a map from 2013 and a self-reported obesity. So that's a little different than actually going to the doctor who says you're obese. But as you can see, there's different countries. It's kind of like the red, which has the highest amount of obese people, is Mississippi and West Virginia. I don't know, I was a little bit surprised about West Virginia. And I think, was it Washington, D.C.? No, I think it's just West Virginia. And then if you look, there's nothing that has less than 20%. I don't see anything. But in Hawaii, you can see there's 20%, in Montana, California, Utah, Colorado. And then if you look on the right side of the map, in Vermont, in Maine, less than 25%. So let's look at your state. I'm going to look at Wisconsin because that's where I live. So it's anywhere from 25% to less than 30%. And to me, that's a lot. And like I said, there are states that have greater than 35%. So as you know, childhood obesity is on the rise, and it's a huge health concern. One of the reasons is that we're noticing more and more younger children are actually getting adult diseases that are related to obesity, such as high blood pressure and diabetes. So we're seeing more and more children with that now. So the obesity prevalence differs among racial ethnic groups and also varies by age, sex, and adult, head of household, and education level. And as you can see, I have some of the stats on the screen that you can always look at a little bit later. And I got these from the Center for Disease Control, which is at cdc.gov. So how do you do a lifestyle assessment on a patient? So when you go into the room and you're asking a patient some questions, remember you're always asking a social history. So in the social history, you want to know what they do for a job. And if they say, oh, I work construction, you might want to say to them, okay, so what part of construction are you working? Are they sitting in this big, machine that they're just operating all day and drinking Mountain Dew? Or are they out really actually working around and getting some type of exercise? And so we talk a lot about nutrition with the patient. So when patients come in, especially patients that are overweight, and I'm trying to figure out kind of nicely how to ask them um, why they're so heavy. Some of the things that you could do is ask them about the nutrition, and they'll say, "Oh, I don't eat very much, or I don't eat anything. For some reason, if I even wiggle, this thing moves. Sorry." So what I do is I usually ask them, so what did you have last night? Or what did you have this morning? Or what did you have for lunch? Just to kind of get an idea of what they had. And if they said, oh, I didn't have anything for lunch, Dr. Parve, I'll say, well, what did you have for breakfast? And what did you have for dinner? And then did you have any snacks after dinner last night? And I always like to know, what do they drink? So do they drink a lot of juice? Do they drink a lot of soda? Do they drink a lot of alcohol? Do they drink a lot of things that have a lot of dense calories? And then if you notice, I have on here, read the dietary guidelines under assigned readings. So make sure you go into the overview for week 4, and there's some assigned readings, and they'll help you with patients estimating calorie needs. Because sometimes patients want to know, and we don't want to just guess. I mean, there is research that shows us what they need. And as far as exercise, what is recommended for your patient? So as you know, there's so many different views out there about how much exercise is good. It used to be you had to exercise for 30 minutes 5 days a week, and then it was 30 minutes 7 days a week, and then it was 60 minutes 5 days a week. So what I want you to do, part of your assignment, plus you need it for your patient education, is I want you to go online and try and find some evidence about what is the best advice that you can give your patients as far as exercising. And later on in this lecture, I'll show you a website that I think is really good for you to use. And then when patients come in and you can tell that they're stressed, and as you know, stress can, with that cortisol, it can allow patients to hang on to weight. So sometimes you'll see they'll be agitated, they'll have excessive perspiration, they're sweating like nothing, and you're freezing. They're impatient, they're anxious, and sometimes it just takes them a while to even answer your questions. And so the IOM recommends a waist measurement to measure abdominal fat. So I never did this in practice, but it seems to be that you're really supposed to be doing this. So you might want to ask your preceptors if it's okay if you do this. And I think it's good for patients too, because lots of times they think they're healthy and they're okay, and then you find out that for a man, his waist is really 44 inches, and for a woman, her waist might be 38 inches. And then you can explain to them why we're worried about some of their risk factors with their abdominal area so large. And then always do a BMI on your patient. I know sometimes patients argue about BMIs, but honestly, they're pretty accurate. They're not 100% accurate, but at least it gives you a guideline on where to start with a patient. So how do you start the conversation with a patient about their lifestyle, especially if they're overweight? How do you bring up diet and exercise to an obese patient? Well, I want you guys to think about that this week. As you're out in clinicals, maybe you can ask your preceptor or watch how your preceptor does it. But for me, I did have a lot of obese patients, and I would ask them questions, and I would say to them, you know what, I really think that you need to lose weight. You are overweight. I never told them they were obese unless I did a BMI and showed it to them, like if they didn't believe me. But most of my patients were actually obese here in Milwaukee. So what I would do is I would say to them, have you ever tried to lose weight? And they would tell me no, or they would tell me they have and it didn't work. And so that would at least get us talking about that. And some patients would say to me, you know what? Nobody has ever asked me if I wanted to lose weight, and I've seen the doctor hundreds of times. So I think it's really important as nurse practitioners that we ask our patients and discuss their weight and talk to them about their lifestyle, because we're the ones that can really help them sometimes, because we're not family members. We're somebody, that's neutral, but we're really worried about their health. And what about a parent of an obese child? Okay, so this is not so easy, because I had a couple kids. I had one kid, he was he two? He was either two and a half, was a little girl, and she was 100 pounds. And I said to the parents, the kid honestly could barely walk. And when the kid came into the room, they had soda in their bottle. And I said to the mother, we had him weighed. And what I did is I just pulled up a growth chart so that it didn't look like I was being judgmental. I pulled up a growth chart and I said, here's the growth chart. I had the mom come look at it. And I said, I'm really concerned because this child's like way above the norm. And, this could cause problems later on. And the mom's like, I don't know why everybody talks to me about my child's weight. She's just fine. She just likes to eat. And I said, actually, it's not fine. She's going to end up having some problems later on in life, not only joint problems, because she's already having some problems walking, but she's going to have an eating disorder because she thinks she can just eat all the time. And so after a couple more visits, we ended up getting her over to Children's Hospital and working with pediatricians with her on her weight. I don't know what happened to her after that because I didn't see her anymore because I left the clinic. But sometimes bring it up to parents. They get very upset. But honestly, it's your job, and you're just going to have to work on ways that you can do it easily. The other way you can do it is to print up the growth chart and circle where the child should be. We don't want children losing weight. We don't want to put children on diets. That's not good. But we can change their lifestyle, and now's the time to do it as opposed when they're adults and it's very difficult to do. The other situation you might have is an elderly patient who has come in several times not feeling well, and you notice that they're losing weight, and you've checked all, their labs, and you've done all sorts of studies, and there's nothing wrong with them. They don't have cancer, they don't have diabetes, there's nothing really wrong with them. And so you have to somehow figure out a way to come up with that conversation do you have enough food to eat? Are you able to pay for your food? How many meals are you eating a day? And I have had patients start crying and telling me, that they're getting 600 and some dollars a month from Social Security. Their husband's dead. Their rent is, $450, $500, and there's not a lot of money left over. And there are government programs and there's local programs for elderly people. And I want you guys, when you get time, because I know you're all busy, to look into that into your community so you have a resource for your elderly patients. So when you do physical assessment, you can see on the screen that you can kind of tell by looking at a patient and examining the patient whether or not they have good nourishment or not. So with a well-nourished patient, you can just tell they look happy, they look energetic, they're sitting up straight, their skin looks nice, they look good, they have a lower heart rate. They don't seem to be huffing and puffing just getting to the exam room, which sometimes is not very far. But with a poorly nourished patient, you'll see that they don't have a lot of vitality. They're just sluggish. Their skin is pale. Sometimes they're kind of slumped over. They just don't have a lot of energy. They may weigh more or less than they should. Sometimes they actually appear high-strung because some of them are high-strung on Mountain Dew, Coca-Cola, and coffee because those are very cheap things to fill you up that you can drink. Sometimes you'll see that they're short of breath. Sometimes they have some chest pain because they just seem to be working so hard. And when you're doing your musculoskeletal exam, you'll see that they have less muscle tone and limited range of motion. So sometimes you can add that to what you've talked to them about and kind of come up with a diagnosis. You may need to include a fasting blood sugar. I saw a patient once, he was, I think, 10 years old, 10 or 11 years old. His parents had gotten divorced maybe 6 months before. And I actually saw him, I thought he had the flu. It was during flu season. And he was just laying on the bed. He was so skinny. He just didn't look good. I personally wasn't sure what was wrong with him. I thought, well, he probably has the flu. So I checked him. Sure enough, he had influenza B, but I also drew a BMP. His sugar was 700. And his mom started crying. She said, I thought he was losing weight because he was depressed because we'd gotten divorced. Here he was a diabetic, and she had no clue. So if you see children that are losing weight or adults that are losing weight and they're not obviously trying, besides doing a blood sugar, also you want to check, of course, their thyroid and any other tests you might think that you need to do. And some of the related medical problems related to obesity and lifestyle problems are hypertension, hyperlipidemia, diabetes, and of course the good old metabolic syndrome, which you'll learn about in cardiology. So some of the components of a healthy lifestyle is nutrition. So I do have, and don't mind me, sometimes I have trouble switching screens. I do have something on here that's kind of related to this. So let's first talk about, you could talk to your patient about decreasing some of the things in their diet that they have right now and increasing other things. So I decided to make an acronym of FATS. So I kind of switched things around. So they need to decrease their fats, their alcohol, their cholesterol, but I made it total cholesterol so that the acronym worked better. Sodium, they need to decrease that. You can see less than 2,300 milligrams daily, and if they have hypertension, less than 1,500. And if you have a patient with hypertension, you should talk to them about their sodium intake. And then, of course, their sugar intake. And remember, there's a lot of hidden sugars. And what I tell people, especially parents, is that when you look at the sugar, if you're looking at a label and it says that there's 14 grams of sugar, that means that there's 2 teaspoons of sugar in that. So I want you guys to look at a regular soda sometime and you can figure out how many teaspoons of sugar are actually in there. And I used to teach it in the schools and the kids would just be horrified. And then you want them to increase their vegetables, their fruits, their whole grains, seafood, if they can tolerate seafood, and then milk, preferably low or fat-free. And then I'll see if I can get to these guidelines for you. I have them, I think, on the bottom of the screen. Yeah, so one of the things that I really like is the USDA's ChooseMyPlate.gov. And you can see they have a lot of good resources for patients. I do teach them a lot about Choose My Plate. I used to have paper plates in my office and a marker, and I used to go over that with patients, especially diabetics, but anybody that was overweight. I said, instead of counting calories, let's just work on how you fill up your plate and how big your plate is. So you can see that you could talk about my plate. You could talk about weight management, so weight and calories. So we're talking about like how many calories are in some dishes, weight management. Let's see if I can click on this. My goodness, I think I have the slowest internet here at school. Okay. So it's talking about like what are you eating and drinking and how many calories and stuff are in there. The other one that I liked was, okay, sorry. Oh, I'm gonna make you all dizzy. Come on, weight management. Decrease your portion size. So I tell people it doesn't mean you have to give up everything, but you just can't maybe eat as much as you normally do. So if you're gonna have some mac and cheese, maybe it shouldn't be a whole big bowl. Maybe it should be a little bit smaller. So this just talks about decreasing your portion size. So this is one of the websites that I can send patients to. Maybe you can make out a little flyer, or they might even have some that you can buy for all I know. I didn't even look or get them free, but maybe you guys can look into that. Okay? Let's go back to the PowerPoint. Okay, so some of the benefits of eating well. You have a sense of vitality, you can maintain a healthy weight. They've been able to prove that you can decrease your depression and anxiety in most people, not in everybody. You can decrease your risk of diabetes, hypertension, heart disease, and some cancers. And you can feel more self-confident and have increased energy levels. And it doesn't mean you have to go crazy and do, what's that, insanity workout. You don't necessarily have to do that. What I started doing is a 30-minute workout every morning, which has really helped me lose weight, as well as trying to get 30 minutes in during the day of walking. So one of the issues I have is that I have a very sedentary job now that I'm teaching, especially online. I'm sitting on the computer all the time. And so what I've done at Concordia is I try and get up 3 times a day and take a 10-minute walk. So you don't have to do a 30-minute walk all at once. You can go ahead and do 3 10-minute walks. So even in clinicals, if you have a couple minutes between patients, go outside, walk around the clinic. If there's stairs there, maybe do the stairs a couple times. And then for this week's discussion too, I'd like you to post some online resources for patients and providers for healthy eating. It's always fun when we can share with each other, and I've had students show me some amazing resources that I didn't even know were out there. So if you look in your textbooks, and I have mine right next to me, on pages 125 to 130, it talks about key consumer behaviors. So this is a nice little thing. You can either copy it on a copier and then bring it with you if you're not bringing your books with you to your clinical sites, but you can see there's some things that you can talk to your patients about. Key consumer behaviors, topic areas, and potential strategies. So it talks, just like, look at, we were just talking about physical activity, and it says here, start with 10-minute chunks of physical activity a couple days a week, so they don't have to go nuts. They can just start little and go big, okay? So stress management. You guys all know about stress because you're in school, okay? So most of you are working, you've got kids, you've got families, you're in school, you might be taking more than one class. I know you're all stressed out. So stress affects a lot of things. It affects your sleep, it affects your relationships, you know, so you snap a little bit more with people. It's harder to relax. It's harder to manage your time because you have so much stuff going on. Some of the things you can do, however, is, go back to time management. So if you can't manage your time and you're stressed out, you need to manage your time. So just keeping a calendar. I have a calendar on my phone and I put everything in it. Also, prayer helps a lot of people, taking time to pray either every morning, every night. Just taking that time to relax and pray for people around you, pray for yourself. And then your perspective on life. If you're an optimist, you fare a lot better than a pessimist. And then I want you, when you have time, and I know you're busy, but this is a very interesting, healthy lifestyle assessment test. And you can even give this to your patients to take. And you'll be amazed when you take it. Like, it gives you some pointers, and it also shows you like things that you need to change in your life. And then, of course, you need to, every visit, talk to your patients about smoking. And Dr. Peters, who is an expert in this, is going to be doing a short recording on smoking cessation that you need to watch because there will be some questions on your exam about that. And then, of course, you should have universal screening with domestic violence. I know lots of times people have a hard time asking patients about that, especially patients that they think they know really well. But sometimes you'll see some clinical presentations where you'll see these repeated physical injuries, especially to the head, neck, upper buttocks, breasts, and back. They might not come in for a while. So when you say, well, when did this happen? And they're like, oh, 3 weeks ago, you're going to say to yourself, I wonder why they took so long. You might see eating disorders. You might see like some type of cyclic vomiting, and you're just not sure why they're doing that. Diarrhea, constipation, anxiety and depression. I put in their bite marks because I had a patient that came to me, and I didn't know what they were. She had these circular things like all over her body. They were on her neck, her breast, her back, her tummy. I thought she had lupus. I mean, that's what it looked like. They weren't totally circular. They're a little oval. They were everywhere. And I kept asking her, how did you get these? She's like, I don't know. And so I checked her for lupus. She didn't have that. I did a bunch of other blood work. I couldn't figure out what it was. And then she came back again and she had more. So I said to her, is there anything going on at home? Do you feel safe? And she says, well, my boyfriend is very mean and he bites me. And I was like, are you serious? Like, I mean, he's really, really biting her. So you always want to make sure you ask people questions. I also had another patient come in who was a refugee, and she came in several times complaining of headaches. And I kept saying, oh, well, I checked her blood pressure. That was fine. I gave her some Tylenol to take and said, when you get a headache, take the Tylenol. She came back and she said, well, when I get a headache, I take Tylenol. It doesn't work. So then I said, how are things at home? And then through the interpreter, I found out that her husband was beating her with a broom on the top of her head. And I never thought to ask that. It just never dawned on me. And when I touched her head, it was so tender. So when patients complain of headaches, make sure you touch their head all over and see if they have any soft spots or any tender spots on their head. Same thing with their neck. If they complain of back pain, touch them, okay? Because you're going to be able to tell when they wince that maybe they've got bruises underneath their clothing. Okay, you need to document any physical findings, even though you think they're minute, because you might find out over time that there is a pattern there. And then if you go to this website, it's good for providers and it's also good for patients. One thing I did forget to talk about was one of the first screens about obesity that I want to go over here at the very end is, let me pull it up. It's talking about, even though this is from 2005 to 2008, it's the most current one that I could find on this website. This is the same website that had the maps on them. And so it talks about obesity amongst different ethnic groups. And so one of the things that I thought was interesting that I noticed, and it can help you in practice, if you notice amongst all the groups there, the non-Hispanic Black men and women have the highest rate of obesity. So in the women, it's more than 50%, especially among those that have the poverty income ratio of less than 130%. So the poorer they are, the higher their rate of obesity is. And you might say, well, why would that be? Well, lots of times it's because the foods that they're eating that are inexpensive foods are not necessarily good foods for them. So I want you to look at this chart, study a little bit because there might be a question on the exam about this chart for you. So I hope you learned a lot today. I hope it gave you some things that you can do with your patients as far as lifestyle assessments and preventative care. And I hope you all have a great week. Now if I can just get out of here, we'll be good. Okay, that didn't work.